my name is Kalani. I'm a student physical therapist, and today we're going to be doing a mock practical for my patient Michael Scarn in the acute care setting. So let's get started. Hi, Michael. My name is Kalani. I'm a student physical therapist. I'm going to be helping you out today. We're just going to go through a couple of things, but before we get started, can you give me your name and date of birth?
Michael Scarn. I'm 63. Date of birth 12/21/2034.
Perfect. That matches my records. So, what we're going to do today is we're going to just assess your mobility so that we can decide how we're going to get you out of here. If that's all right with you.
Yeah, I guess that's fine.
I guess that's fine. How have you been feeling today?
Everything hurts.
Everything hurts. Can you tell me anywhere in specific?
Well, the cut that they made in my abdomen hurts.
Mm-hmm.
And the cut that they made in my back for this tube hurts.
Okay.
And my head hurts.
And your head hurts. Okay. Have you been drinking water?
Trying to.
Okay. I'm just going to roll this down, okay? I'm just going to assess your incisions, if that's all right.
Sure.
Okay. Is this where it was?
Yes.
Okay. Just going to look at your skin. Okay, it's a little bit red, but it seems to be healing. Is it itchy? Has it been itchy at all?
Not really.
Okay. Just painful. Has it hindered your sleep at all?
It did last night.
Last night. When was the last time that they gave you morphine? Do you know?
I don't know.
You don't know? Alright. Oh, it looks like you have an AV fistula.
Sure.
Have you been doing dialysis?
Yes.
Okay. When was the last time you did that?
3 days ago?
3 days ago, before your procedure?
Yes.
Okay, and I see that they have the nephrostomy bag. Is that where your incisions are in your back too?
Yes.
Okay, perfect. Okay, when I sit you up, I'll take a look at those.
Okay.
If that's all right. I'm just gonna make sure you're wearing some socks. Okay, looks like you've got the proper attire on. And while we're laying down, I'm also just gonna take some vitals, okay?
Okay.
We can't take it on that arm, just because you have the fistula and we're not supposed to take it on that side. So we'll take it on this side, okay? Where your IV's at. Has everybody been treating you okay here?
Very nice.
Good. Let me put this on this side. I'll take your pointer finger for me. We'll go right on the skin. Pretty regular here, okay? We got you at 122/84. And that's pretty normal, so that's good. All right. While we have you laying down, we're just gonna run through a couple of things to assess how you're moving, okay, before we get you sitting up.
Okay.
So in each position, we're gonna do like a little bit of a mobility index. So we'll have different things for you to do at each position. So we'll do some in sitting, we'll do some in laying down, and we'll do some at the chair and walking and standing, okay?
Okay.
All right? How do you feel about that?
Sounds like a lot of work.
A lot of work? Well, we'll go at your pace, and it's okay if you're unable to do any of that. And it looks like you are oxygenated at 98, and 80 is your heart rate, which is also within the normal range. Lovely.
80's not bad.
Not bad. Do you mind if I down just a little bit?
Sure.
Okay. Just making sure we're all covered here. Okay, I'm just gonna move this blanket, put it on the chair. All right, so the first one is we're gonna do a bridge, okay? So I'm just gonna have you tuck your knees under. Can you tuck this one up for me? How you feeling?
My stomach hurts is all.
Your stomach hurts? Okay. Do you think if we lift your hips up, that will also make it bad?
I think so, but I'm willing to try it.
Okay. If anything, I just want you to engage your glute muscles.
Okay.
Okay? How does the glute muscles feel when you engage them? Feels okay?
Feels okay.
Alright. Do you think we can do the whole thing?
Maybe.
Alright. I'll be here just in case. Good job. Come on down. Okay, perfect. While I also got you here, can you lift this arm above your head just like this? We're gonna just look at your range of motion. How's that feeling?
My shoulder feels a little tight.
A little tight. Okay, on the other side. How's that feeling?
About the same.
About the same. When was the last time you got out of bed?
3 days ago.
3 days ago?
Yeah, before
Okay.
the procedures.
Has anybody gotten you up prior?
Just to go to the bathroom.
Just to go to the bathroom. How was that for you?
Humiliating and cold.
Humiliating and cold. Well, I'm sorry. We'll get you up today and see if you're able to do it on your own.
Okay.
Okay? Alright, you can go ahead and put your legs down. For the next item of business, we're just gonna get you up and rolling onto your side, okay?
Okay.
Do you feel like you need some assistance, or do you want to try it on your own?
It'd be nice to have some help.
Okay. We're gonna roll towards me,
Okay.
okay? So, first things first, this leg is gonna bend just a little bit, okay? Good. Okay, this arm is gonna come all the way over. I'm gonna have you scoot that way. We tested the bridge, so we're just gonna have you move. Okay, can you move your shoulders? Shimmy, shimmy. Alright. Okay. Now this arm is gonna be doing the majority of the work. Okay, we're gonna roll towards me, and then we're gonna have you push to sit. Good. Good, nice. Okay, can we push to sit? I'll bring your legs in front for you. Good job. How are you feeling?
Feels great.
Okay, so here's when I would take some blood pressure vitals again, just to assess how he's feeling. Are you having any symptoms of lightheadedness or anything like that?
No, just a headache.
Just a headache. All right. Okay, we're gonna take it nice and easy today. Lying to sit. I'm gonna assist supervision. Okay. Good job. Okay, how are you feeling here? Do you feel like you need me to help support you, or do you feel like I can walk around you?
I think you can walk around me.
Okay, you're feeling all right here? How's the pressure on your incision?
I'm not gonna bust a stitch or anything, but.
Okay. All right, I'm gonna grab this gate belt and I'm gonna put it around you. And I'm also gonna bring your nephrostomy bag forward so that we can get ready to move to the chair. We'll just tie you up here.
Yeah, I've got a nice ass, but not everyone needs to see it.
Yeah, that's reserved for some special people, huh? All right. And when we stand up, I'm gonna clip this to your gown. Okay, so it's out of the way. Actually, let me just double check your incisions. You said these were being painful for you too?
I mean, I feel like regular got cut open painful.
Yeah. Okay. Not bad. Not bad. Michael, do you know what day it is today?
Thursday.
Thursday. Beautiful. Do you know what you had for breakfast today?
Hospital food.
Hospital food. Alright. I'm just going to make sure I go above your incisions back here. They look pretty okay. They just need to be protected. And it looks like you got that bandage on you. Okay?
Sorry, we take it a little higher.
Yeah.
Thank you.
Okay, lovely. How's that feeling? Not too snug?
No, it feels good.
Okay. Not catching on anything. Okay. Very nice. So while we're here, I'm just going to also assess some of your lower extremity strength, so just your lower legs. All I want you to do is go ahead and kick into my hand. Okay? I'm going to try and push you down. Can you hold this here?
Yep.
Okay, ready? And hold, hold, hold. Good. And I'm going to do the same on this side. Kick into my hand. And then I'm going to do the same. Ready? And hold, hold, hold. Very nice. Your strength is good. We're going to also assess some power for when we go to sit and stand so that you're able to get in and out of your chair nice and easy today, okay?
Okay.
So, right here, you're able to sit unsupported. And we're going to do sitting in a chair. Lovely. Okay, so when we stand up, hold on, let me clip this together real quick. Below your kidneys. Okay, so can you scoot towards me just a little bit? Good. Good. So I have this walker here. It's just in case. It's just a precaution. I think you're strong enough to stand. We'll test it out. But while we're in the hospital, we're going to use the walker, okay? So when we use the walker, make sure with this hand we're not pushing too much pressure in it. We're just moving it along and taking steps.
Okay.
Okay? All right, you ready to stand?
Ready.
Okay, 1, 2, 3, stand. How do you feel here?
Yep.
Okay, and this is when I would assess your vitals again, just to make sure nothing is changing. How are your symptoms?
Fine, I think.
Fine, you think?
Yeah, nothing hurts more than usual.
Okay, great. Okay, if I stepped away, do you think you could stand by yourself?
Yes.
Okay, just like this, and we're grabbing onto that walker. Okay, beautiful. Okay, now all I want you to do, we're going to aim towards that chair. So I'm going to take a couple steps forward, turn, and then I'll help you sit.
Okay.
Ready?
Ready.
Go. Step forward. Step forward. Okay. All right, go ahead and turn towards me. All right, I want the back of your knees to find the chair. And we're going to slowly sit down. Very good. How you feeling, Michael?
Feels good to sit.
I know, if you haven't stood up in a couple of days, I can understand how that might feel for you. Okay. Just going to clip this a little bit lower so we're following the precautions here. Okay, so in the chair, what we're going to do is we're going to do a sit to stand, okay? So I'm going to time you for 30 seconds, and I just want you to do as many stand up, sit downs as you can. All right. The idea is that we're not going to use the chair to push off or sit down. Okay. So we usually have patients cross, but if that doesn't work, you can reach and grab for the walker instead. We're just assessing your lower extremity strength and power to make sure you're functional for movement, getting in and out of chairs and cars and stuff like that.
Okay.
Okay? So when I say go, you're gonna start standing up, okay? So can you sit at the edge of the chair? Good. All right. Okay, so when you're ready, cross your arms, cross your chest, okay, and I'll be here. Or if you want to, you can reach for the walker. Which would you prefer?
I'll have it like this.
Okay. All right. How about we use your other hand?
Okay.
Yeah. So we're not putting pressure on that side.
Okay.
Okay, ready? And go. Good job. Nice and slow. How are you feeling?
Tired. So much work.
All right, and that's 30 seconds.
Oh, thank goodness.
So we got about 4. And so what that means is that we're just a little bit limited. And that's okay for where we're at. All right? We're just assessing a baseline.
Uh-huh.
Very good. All right. And so you were able to stand pretty unsupported with your feet together. Oh, sitting to stand from the chair, and you didn't use the arms. So that was really good. Okay. Next thing, we're going to assess how you walk and your static balance. So just your standing in place balance, okay? How are we feeling? Okay. All right, Mr. Scarn. So now we're going to assess your standing balance. So we're just going to do a couple of things, just standing up. How are we feeling? You feeling okay?
I'm just really tired.
Okay. We're almost done.
Okay.
And then I can leave you sitting in this chair or laying down, whatever you prefer.
Okay.
All right. You ready? We're going to try and stand up again.
Okay.
If you need to, you can grab onto the walker with this hand. Ready?
Ready.
1, 2, 3. Very good. All right. All right, so here, I just want you to stand with your feet apart. Feet apart, good. How are we feeling with that?
Feeling okay?
Good. Counting. 10 seconds. Okay, can we stand with your feet together? Good job. All right, keep your eyes up. Chest up. All right, go ahead and stop. Can we stand on our tippy toes with our feet apart?
Oh.
Okay, not bad. Good job. Come on down. And can you stand with one foot in front of the other?
Oh, man. I haven't had to do this since my last DUI.
All right. Now we're going to close your eyes.
Whoa.
All right, come on now. Stop. You can put your feet regular again. Okay. From here, Mr. Scarn, are we ready to walk?
Yeah.
Okay.
Ready.
Our goal is just 10 meters, okay? So that's like from here to the bathroom.
Okay.
Okay? I got your IV pole, so we're just gonna go forward. How are we feeling?
All of my war wounds are aching.
They're aching.
Yep.
All right. Do they get worse as we go along?
Just like the jostling of the steps.
All right. Let's go ahead and turn around. Okay. Go ahead and walk. Any dizziness or lightheadedness as we're walking?
Not so much.
Okay. Just gonna make sure we're not gonna sit on any lines here. Okay, go ahead and back on in.
Beep, beep, beep.
All right, Mr. Skarn, we're gonna also do some dynamic balance while we're in standing, okay? So I'm just gonna move the walker in front of you a little bit. How are you feeling standing?
This is fine.
Okay. I'm gonna put a pen on the floor, and your object is to grab it. And if you can't get it, also okay. All right? How are you feeling?
I don't think I can get it.
Okay, no worries. No worries. A couple more things is, do you think you can walk 4 steps backwards?
I think I can do that, yeah.
Okay.
Moonwalk. Moonwalk. Moonwalk.
Good job. All right. We're just gonna walk back forwards. How you doing without this walker?
It's definitely easier with the walker.
Definitely easier. Okay,
Yeah.
we'll keep it.
Okay.
Okay, and the last thing is jumping. How do you feel about jumping?
Not a snowball's chance in hell.
All right. All right. We'll just leave you sitting down then, okay?
Beep, beep. You know, because I've got a dump truck.
Sure. Good job, Mr. Skarn. Do you want to be left sitting up?
Yeah.
Yeah? Feels good?
Yeah.
All right. And a couple things that I just noticed in your chart, it says that you were a little bit anxious about progression and how to, leave the hospital. That was making you a little bit anxious. So from what we talked about today, you have very good mobility. Your range of motion is looking okay, and we were walking pretty well. I would still advise for some supervision, but I think we did okay for not having gotten up for a while. So what I would want to do next is, because of your incisions and because of the pain that you're still experiencing, we might discharge you to a skilled nursing facility to then help you get back home to wherever you call home.
Home is whatever. That's fine.
Okay.
A lot more pretty girls here than at home.
I'm sure. But, so the skilled nursing facility will also have the care that you need to just monitor your symptoms and everything until you get pretty well healed. And because of your fatigue, I would say not an inpatient rehab, just because I don't want to put you under 3 hours of therapy if there's really no need.
Okay.
So, skilled nursing facility would be my suggestion. Do you have any questions for me, Mr. Skarn?
Do you have a phone number?
I do, but my husband doesn't like me to give it out.
Ah.
All right, well, I'm going to go talk to your nurses and your doctor and write up a note for them saying what we did today. And if you have anything else, feel free to contact PT, okay?
Okay.
All right. We'll see you in a couple of days, hopefully.
Hopefully.